Greetings everybody. I hope that everybody is doing well. Today we're going to be discussing about the history of psychiatric treatment, which is important to understand because it allows us to know the position that we are today. Let's get started, and the title of today's lesson is History of Psychiatric Treatment. Now, in ancient times, mental illness was thought to be caused due to demonic possession or displeasure of gods. We have this information due to manuscripts obtained from ancient Greek, Roman, Indian, and Egyptian civilizations. Now, at around 400 BC, Hippocrates was the first one to describe that mental illness was caused due to a physiological problem. Many experts and scholars often attribute the humoral theory of mental illness to him. The humoral theory of mental illness states that mental conditions are caused due to an imbalance of fluids. In this picture, we can see a physician and two of his assistants treating a psychiatric patient in here. What they're trying to do is they're trying to remove the excess fluid to ameliorate his condition. Now, this view is an important one because it predominated for the majority of antiquity all the way until the 18th century. Of course, there were other treatments available provided by religious orders that simply assumed that patients with psychiatric conditions were inhabited by demons. Now, during the 17th century, patients were treated inhumanely. Most of them were secluded into dungeons and often chained to walls. It was not until the end of the 18th century that French physician Philippe Pinel banned the use of chains and removed patients from dungeons. Now, mistreatment continued in other regions of the world, including America. In this picture, we can see a hospital and a typical cell with a patient inside. Conditions in America did not start improving until the 1840s, where the work of Dorothea Dix, an activist that fought to improve the living conditions of mentally ill patients, starting to get noticed. Thanks to her efforts, 32 state hospitals were established across the United States. This is one of the hospitals that she was able to found, and is known as Trenton State Hospital. Now, during the 20th century, several therapies were developed, including insulin-induced comas, frontal lobotomies, electroshock therapies, and infection with malaria. But in 1952, the psychiatric field was revolutionized with the invention of chlorpromazine, otherwise known as Thorazine. This was the first antipsychotic developed, and it was developed in France. And it allowed many people that were previously in institutions to move back into community. Nowadays, we employ the biopsychosocial model to better understand psychiatric conditions. We study the biological, psychological, and social aspects of mental illness in order to provide a bigger picture of psychiatric conditions. We commonly employ drugs and psychotherapy in order to provide medical care, and sometimes even a combination of the two. Okay, now extensive research needs to be devoted into the creation of novel therapies because many of the medications that we currently have adverse effects. For example, antipsychotics. Prolonged use of antipsychotics often lead to the condition known as tardive dyskinesia. Thank you for your time, and I hope to see you next week. Once again, thank you.